While talking on literature review, I told you about the importance of scholarly criticism. We have to scholarly criticize each article and find out the validity of epidemiological study. So what is the term validity means? That is very important. And what is this validity? What is validity? I am doing a study to find out the rate of depression in post-COVID patients. Okay. And in that study, it is depression in post-COVID patients. And in that study, I am using a tool to find out the presence of anxiety. Is the study valid? No. So, validity means it is the ability of a tool to measure what it is supposed to measure. Okay, if I am studying on depression, I should use a tool which exactly measures depression in the study subjects. Okay, so that is validity. And what are the objectives of any epidemiological study? And the objectives of any epidemiological study is either to accurately measure the presence of the frequency of disease, or to find out or accurately estimate the effect of exposure on outcome, isn't it? So the accurate estimation of either disease frequency or effect of exposure on outcome, or association between exposure and outcome. For any studies, this is one objective. So this how can we tell that it is an accurate estimation? That is by looking at the methodology, study methodology. So this is inside the study. So we can call it as an internal validity. Okay. So this, that is doing inside the study by looking at the methodology, or we can tell that the study is giving an accurate estimation. So that is called the internal validity. Okay. That is internal validity inside the study by looking at the methodology or correcting the methodology. We can increase the internal validity. And I already told you that the study is mainly for a large population. Maybe at-risk population, or maybe the population suffering from a disease, or susceptible population, whatever it is. And from that big population, as we cannot conduct a study in such a big population, we are taking a sample of the whole population. Okay, that is sample by looking at the calculating the sample size, and also doing some inclusion criteria and also some exclusion criteria. So from a big population, we are conducting the study on a defined or predefined sample. So this internal validity is for this sample, and if it is correct, this sample, we have to generalize this sample into the whole population, to the external world. If I am studying the effect of depression in post-COVID patient in a small sample, if the study conducted, and I have to generalize the effects or the result of the study to the whole population, right? So that is called external validity. Okay, so that is, if I am generalizing this internal validity to the whole population, so it is called external validity or generalizability. Okay. Or generalizability. Right? So, validity you know, and the internal validity and also external validity. And what is this accuracy, accurate estimation? The accuracy is the product of precision and validity. Accuracy is a product of precision and validity. What is precision? Precision, you are using a weighing machine to measure measure the weight of a baby 5 times. You measured 5 times and each time you got a weight of 3.2 kg. So you can tell that it is very precise. The weighing machine is precise. So on repeatedly doing, you have to get same result. So that is precision. And in this class, I will tell you about the validity of epidemiological studies. So errors in estimation. Okay, errors in estimation in any study. And this can happen due to two types of errors are there. One is a random error and another one is systematic errors. And this random errors are due to chance. There is errors in estimation or there is defect in the estimation of results due to causes which are uncontrolled, which occurs by chance. This occurs due to chance. This is beyond our control. Okay, so the random errors can be minimized by increasing the sample size. Okay, so that is about random errors and we can minimize that by increasing the sample size. And this is beyond our control. Okay, and the systematic errors are bias which adversely affect or reduce the accuracy of any epidemiological study. So systematic errors are something related to validity of any epidemiological study. So systematic errors are related to validity and systematic errors are due to bias. Okay. Systematic errors are actually a threat to validity of any epidemiological study and these are the threat that will lead to bias and that will lead to reduction in the accuracy or errors in estimation of any epidemiological study. So one is a selection bias or it can be an information bias or it can be a confounding. So selection bias, information bias and confounding will reduce the validity of any epidemiological study and that is inside the systematic errors, and other type of error is random error which occurs only by chance and that we can reduce by increasing the sample size. Okay, so what is this selection bias? Name implies selection bias occurs at the time of selecting the participants for the study or for analysis. So that what will happen? The selected study population will not represent the target population. That happens if there is a selection bias. This selection bias occurs at the time of selecting study participants. Maybe in a case control study where the chance of selection bias is more, and also it can happen in cohort studies. So in all these stages, one is surveillance. We want to give a surveillance notification to all exposed cases. See, we are giving surveillance notification to exposed cases. So there is chance of more exposed cases coming to the study. Second is we select individuals by doing a screening test or diagnostic test. Okay, and if the measures of the screening or diagnostic measures or the criteria for diagnosis or screening is not absolute, there is chance of more of exposed cases coming into the study. So in order to reduce that, you have to plan a very strict criteria for screening as well as for diagnosis before start of study. And we take the hospital records to select the participants. In their cases, more of exposed cases can come or the high risk cases can come to the hospital. So again there is chance of bias. So it is better to go for population studies. Okay, to take population based cases and controls, especially in case control study, to reduce the selection bias, it is better to go to the population than to hospital records. Then selective survival of the cases, there is another difficulty we can have. Okay, and also non-response and loss to follow. This can especially this will happen in the case of cohort study where there is a long follow period. And this non-response or the loss to follow will increase the chance of selection bias, and even a 20% loss to follow will introduce bias into the study. So especially in a cohort study, always keep a record of all those who are on follow and also on loss to follow, and get a very correct data or information from both groups, exposed and also non-exposed, and also stick on to good criteria or an accurate criteria for screening and diagnosis. And in the analysis part, it is better to go for a sensitivity analysis in order to reduce the chance of bias. Okay, so that is regarding selection bias. The next is information bias. Information bias is a bias which results due to defect in the measurements of exposure, outcome, and also other variables. So the question asks, you have to ask is, do the measurements exactly measure what is the phenomena of interest? If there is fault either from the side of the individual or the study subjects or from the investigator, both side bias can occur. And from the study subjects, especially if the subject is exposed to a particular variable, the exposure is there, the subjects will be more anxious, and he will even tell or exaggerate the minor symptoms or the minor points. And in a case control study, there is chance of recall bias is there, especially the non-exposed individuals will forget some points. And also from the side of investigator, there is chance that he will look or probe questions more towards outcome in a case of exposed individuals. So all these can be kept in mind. And also there is a term you have to remember is prevarication. This is systematic distortion of the truth by the study subjects. This also comes under the information bias. So how can you reduce the information bias? One is precise operational definitions of all variables, of the exposure variables, other variables related to outcome, and also other variables. You have to give a precise operational definitions. Then detailed measurement protocols, that is you have to give put definite guidelines for whether it is a screening, whether it is inclusion of exposures, or whether for diagnosis. Measurement protocol should be very definite and detailed. Then repeated measurement of key variables. Okay, if there is a key variable, it should be repeatedly measured. And training, certification and recertification of data entry persons. A thorough training of them should be given, and it should be periodically evaluated also. Data audit of either the interviewers or of the data senders, and data cleaning either by software or by other method, cleaning of data, and also you have to do a rerunning of the analysis prior to publications by all these methods, especially by the precise operational definitions and measurement protocols, detailing and repeated measurement of key variables. These three are very important to reduce selection bias. Okay, and the next one comes here is confounders. What is confounders? What is a confounder? It causes confusion in the effect. Think that you have an exposure and you have an outcome. For example, you have coffee drinking and the outcome, there is a study that the coffee drinking increases the chance of coronary heart disease. Okay, so coffee drinking is the effect and coronary heart disease is the outcome. So here a confounder is smoking. Okay, and this smoking is a confounder, and it will modify the effect of both exposure and also outcome. Okay, so smoking is a confounder. Smoking may be more associated with coffee drinking, and also smoking will cause hypercholesteremia, such things, and also it will increases the chances of coronary heart disease. So it is a confounder is a confusion effect which will affect both exposure and outcome. So what will happen? This will simulate. It is an extraneous agent which will simulate as if there is an association between the exposure and outcome, or it will increase the association, or it will reduce or hide the association also. It will change the direction of an effect. So a confounder may simulate an association between exposure and outcome, or it will hide an association between an exposure and outcome, or it will simulate, or it will hide an association, or it will increase or decrease the strength of association, or it will change the direction of an effect. Okay, so this is actually a nuisance, and it has to be the thorough knowledge of the confounding factor. The investigator should have a thorough knowledge of the confounding factor, and this has to be eliminated or avoided as far as possible. There are so many techniques for that. The confounder can be tackled at the design stage or later at the analysis stage. So at the design stage, either you can go for restriction of study participants. What is that? If you are going to study the effect between coffee drinking and coronary heart disease, you can restrict the participants having smoking. That is one restriction, or matching can be done, and also randomization. Randomized controlled trials will reduce or will get rid of this confounder to a greater extent. And in the analysis part, one is stratification. That is, investigator should have an idea of the variable having the confounding effect, and stratification of data has to be done. And also multivariate analysis. Multivariate analysis, where we use regression techniques, be it a linear logistic regression. Okay, so it can be done at the design stage, restriction, matching and randomization, and at the analysis stage either go for a stratification of analysis or go for a multivariate analysis to reduce the effect of confounder. Okay, that is important. The word, the meaning you have to know. Confounder is a nuisance or a confusing effect variable which can affect both exposure and outcome at the same time. Okay, so now you know how to validate an epidemiological study. In a literature or anywhere, if you found a crude association, first look at whether it is due to chance or not. If it is chance, try to reduce it. That is a random error, chance, and that is eliminated by increasing the sample size. And second, look at whether there is any selection bias. And reduce the selection bias by the methods already described. And then look for whether there is any information bias. And then look for presence of any confounder or not. If all these are under control, then you can tell it there is an association between the exposure and outcome. That is a true relationship, that is a causal association. So these are the different types of biases or different types of threats for validity of epidemiological study. And in some cases, like in a random error, you cannot avoid bias. In that cases, you can tell this in your publication or in your paper as a limitation of the study also. Okay, so this is how you have to validate an epidemiological study.